morning, and Mr. Nat King Cole ushers us on to the program this morning. As always, the program is a Viewpoint, a program of personalities, politicians, and perspectives. America's most graded listened to radio program at this hour of 8 o'clock in the entire continental United States and perhaps Alaska. All right, let's get serious. We have a couple of have a little memory problems this morning. We have a couple of guests. Judy Kay, take off with the kudos or two, or maybe 3 or 4, whatever you want to do. Mike's yours.
I don't have that department. Remember, that's you.
You were telling me this morning you want to say something about the Salvation Army.
I went over there yesterday, and I got a name.
Short-term memory.
I got a name of a little boy who's 2, and he would like a toy, anything that lights up. I didn't have any boys, but I think things have to make noise and light up before little boys are very impressed. So this little 2-year-old wants something that will light up. So I'm going today to find something for him for Merry Christmas from the Salvation Army. They do that. They've done that since Hector was a pup, and they do such a nice job of it. Don't you think?
Well, the Salvation Army, the Chief will be able to tell us that because I'm sure they have to work with them from time to time. The Salvation Army just does a tremendous job in a particular community like ours, especially a small community. You know, we're kind of an intimate community here. And so kudos to the Salvation Army for all the great work they do.
Really?
And by the way, that might be a place if you have a little extra money. You don't have to look for them when standing on the corner. Pick up a 44-cent stamp and send them a little check.
Yeah.
They'd appreciate that.
You betcha.
I have a personal kudo, not to get personal business on the air this morning, but I had an occasion not too long ago to... Judith and I have talked about how lucky we are to have our hospital in our community. Mm-hmm. And we've mentioned that many times as we've gone by. And it just happened the other day that I had an occasion to visit the ER room. And I just have to toss a huge kudo off to the way they handled the old fella. Dr. Susan Harmon's in charge of that ER department, and she's got him whipped into shape. Seriously, folks, take a minute to be thankful for the fact that we have the Memorial Hospital system here in Lincoln, Illinois.
Amen.
And kudos to Dr. Harmon and her excellent staff. Let's get down to serious business here.
Well,
if that wasn't serious enough.
That's very serious. And so is this. Chief Vlahovich of the Lincoln City Police Department. How many officers do you have now?
Well, we're short.
Are you?
We're short, but we should have 28.
Uh-huh.
We're short 2. We're in the process of hiring, and we'll be hiring more coming into the new year.
With the holidays upon us, definitely upon us, I'm sure that you hope that things will be cool, calm, and collected everywhere, as it should be on
like
Christmas.
A quiet season, yes,
Yeah.
Absolutely. We look forward to it.
Yeah.
Chief, if a young man's looking for a job and feels he's qualified, how does he go about seeking employment on the city police department?
It's somewhat of a complicated process, but as long as you follow the steps, it can be easy. We just finished what we call a new hire list. Those that don't have experience. The Fire and Police Commission runs candidates, those who apply, through a series of tests. The first step is a written test that they get online and do online. It's through the National Testing Network. Should they pass that test, then they establish a list based on the score from that written test. And after that, then they go through an interview process. And I sit in on the interviews. The Fire and Police Commission obviously is the one that conducts the interviews. And from those interviews, we tabulate an overall score from the written and the interview, and then place them on what's called an eligibility list. Mm-hmm. So we just finished that in October, and we have 5 good candidates.
Yeah, 5 decent candidates.
Yes.
I'll withdraws the word decent. 5 good candidates.
5 good candidates. So in the hiring process, you're listed on that list from 1 through 5 normally, and when we have an opening, we'll call that person, touch base with them, make sure that they're getting ready, and if selected, if hired, we'll give them what's called a conditional offer of employment based on a background check and then medical, psychological, and polygraph testing. And if they make it through that, we'll send them through the 14-week police academy. The problem that we're having currently is we have some really, really good candidates on this list, and I want to hire these kids. I want to give them a chance, just as I was given a chance 19 years ago, being a new guy, to get started. The problem that we're having now is all of Illinois' academies are full.
Oh, really?
We have spots open for hiring, and because of the climate and because there's been so many retirements and cops quitting throughout the state, everybody's they're hiring as many as they can, and the academies are full.
Now, our academy, is that over in Champaign, sir?
There's don't hold me to this, but I'm going to side.
You're the chief. I'm going to hold you to
Caution.
anything.
That's right, as you should. There's one up north in DuPage County.
Makes sense.
There's one in Belleville. There's one over at the U of I. And then the Buffett family sponsored a brand new police academy in Macon County just outside of Decatur.
Oh.
And it's a top-notch, state-of-the-art academy. So we've called all those places. Oh, and I forgot to mention one, the Illinois State Police Academy down in Springfield,
down Springfield,
by the lake.
Yeah.
So all of those academies are running at maximum capacity because everybody across the state is hiring.
You know, I'm a little surprised at that because I think if I were a young man, I might think twice about that because they aren't afforded the respect that they used to just automatically receive in the olden days when Bill and I were young, I don't think I'd want to get involved in it.
Agreed, Mrs. Busby, but the fortunate thing that we have here is we're a small community.
Yes.
Growing up, you travel to different places and you tell them where you're from, and you get ribbed a little bit about living in small town America, right?
Yeah.
Well, look at the climate, look at society now. People are fleeing those big cities and going back to the small communities.
You betcha.
So you can say all you want about living in a small community. I think now it's a wonderful place to be. And the reason being is we've stuck together look at you folks. You lived next door to one another for over 40 years.
Yeah.
We have a small, tight-knit community. We all know one another. And we are very fortunate here because the residents of Lincoln and Logan County support us. So we're fortunate in that we still have interest from the youngsters wanting to be police officers.
I think it's amazing.
I do too.
Really.
And they don't have we've been on the show prior to, and we talked about that Safety Act that the Illinois legislature passed that's very daunting for police officers, and that was in the cusps of the George Floyd death and, police reform. Yeah. They just didn't go about it the right way. We were all in favor of reform, but not to these extremes where there were a ton of unfunded mandates and things of that nature. But where I'm headed with this is the youngsters, the ones that are just now getting out of college, the ones that have interest in it, they don't care about it. Let's just get on with it, and I want to be a police officer no matter what. And it's good Central Illinois people. that are showing the interest.
What we call the spade, the heartland, what we have
Yes.
here.
That's correct.
Chief, how's your budget situation? Whence cometh your money?
We're doing well. The city appears to be doing and is doing well. We are doing our due diligence. The thing that I can't stand about government, one, is overspending. Two is vendors overcharging government entities just because it's government.
It's there.
Correct. So, since being able to get into administration, I see myself as being very fortunate that I was appointed as deputy chief and was an integral part of forming our yearly budgets and working closely with Paul when it came time for budget negotiations with the city. In forming our budget, we've kept very close tabs on it. We don't overspend. We don't needlessly spend. And in turn, we still try to provide our officers with the best equipment that money can buy.
648-5510. Our guest this morning is Chief Matt Volkovic, a young gentleman whom I respect and have for a number of years. I had the pleasure of living a couple of doors away from the Volkovic family, solid as you can get. And so we're pleased that he was able to step in when Chief Paul Adams left us. And we're happy to have my former neighbor as chief of police. That won't get me anything because I can't drive anymore. No, seriously, I don't want to make light of this. We're lucky to have the quality of police department we have. If on the streets, sir, what would be the biggest problem that quickly come to your mind?
It has, and I hope that it quiets down. Here recently, it's been burglaries and thefts. The other unfortunate part, but you both know me as well as anybody, I speak the truth, and sometimes it's not what people want to hear, but I'm going to say it nonetheless.
Go for it.
It's the sex crimes.
Really?
Yes. It is the most disheartening fact and reality in law enforcement.
Oh, it just must break your heart.
It does. And it's from little kids all the way up to the adults.
It's just hard to
Those
fathom.
crimes never stop coming in for investigation. Very fortunate to have good detectives. They're very well versed in what they do. They're educated, they're trained, they take it to heart, and they, just as the patrol guys do, they work their tails off.
Yeah.
Early in the fall, just in one, let's say, 5 to 7 business day period, one of our detectives caught 7 brand new sex cases in one period, just one 5 to 7 day period.
Oh, dear.
And it seems like they just never stop. We're trying to formulate a plan to thwart this kind of crime. But it's hard because most of the time those types of crimes are secretive and people feel shame to report it.
That's a hidden crime, so to speak.
It's a hidden crime.
Yeah.
But when they do come to light, it affects so many people, both sides of the family. The perpetrator's family,
Yes.
and the victim's family.
Oh, yeah.
That's the worst.
Whether you're the CEO of a major corporation in the country or Joe Smith on the Main Street in Lincoln, Illinois, it's still the same.
That's correct.
I mean, what happened is still the same thing.
Why
Absolutely.
would you see these outbreaks being more frequent?
I don't think it's, Mrs. Busby, I don't think it's an outbreak. It's just
It's It's ever present.
Everywhere, and it's so prevalent, but yet we're not talking about it.
No, I'm sure that's a...
You know, it's hard. First of all, it's hard to talk about.
Yes.
Secondly, it's hard to report. Victims of sexual assault don't like to report the crime against them. You know, sometimes it goes years without being reported.
Which is a terrible thing.
Absolutely. So it's everywhere. If it's happening in Logan County, you know it's happening in Sangamon County. You know it's happening in Macon County. You know it's happening in Champaign County. And it's just profound. If it's profound here, it's profound in other places. There are police officers who are tasked with, especially in the larger jurisdictions, who are tasked with, that's what they investigate, solely sex crimes.
That would be a hard day for a policeman.
Absolutely.
Oh, yeah.
And when they do it, you know, sometimes years on end, they suffer severe burnout.
We have a question for you, Chief.
Go ahead.
If you will.
We have a call. I'll have to get my headset here. Chief, you'll get that headset, and I hope that I hear through my hearing aid, which is I want something. Okay, go ahead, caller.
What's your favorite part about being a police officer?
I'm sorry, go ahead. One more time, please.
What's your favorite part about being a police officer?
Your favorite part about being a policeman?
My favorite part about being a police officer is the people, the interaction with the people. What comes as a close second is problem solving. Every cop is a problem solver.
Yeah.
And if we paid, instead of shunning the police, if we leaned on the police more, I think that this country would be in a better place, because each and every one of us, from New York to LA, Seattle to Miami, every one of us is a daily problem solver.
I hope that answers our question for our caller. Thank you very much for calling in. That's a very profound answer to you, Chief Volkovic. The staffing, do you have rotating? Well, of course you have rotating shifts. The clock rotates. For crying, that's a dumb question.
Well, you don't have to beat yourself up.
I was trying to sneak in the back way and see how the chief arranges his shifts, how we're covered on the 24/7.
We maximize our manpower because we're a small department by working 12-hour shifts.
12-hour shifts?
Yes.
Well, that's interesting.
And everybody's happy about that?
Let's just say,
or up front.
About 80%, 90% are happy.
On that 11 p.m. to 7 a.m. shift, that's not a very happy thing.
No, that's the hard part. Is on their long weeks on patrol, they have to work 3 12s in a row, and those get long.
But being a policeman really isn't it kind of a calling?
It is. Absolutely, it's a calling.
When you were a little boy, did you think someday when I grow up I'm going to be a policeman?
No.
I thought all little boys thought that.
I always looked up to the police because I had an uncle who was a Chicago cop for 25 years.
Is that a fact?
Yes.
Well, I bet he saw things he never thought he would.
Story after story after story.
Oh, sure.
It's just nonstop. So absolutely, I looked up to him. But I was raised right.
Yeah, you were.
It didn't matter what you did for a living. You just respected those elders trying to teach you. I didn't start out to be a police officer. I wanted to be a fireman and never got hired anywhere.
Oh.
Went to college, quit college, and then I thought, I'm going to go into public service. I loved being a fireman, loved helping people. Yeah. Went through all the medical training and never tested everywhere. Tested even in Lincoln a couple times, Springfield, Bloomington, Decatur. I just never got hired, and I loved working with my hands, so I became an electrician. So I worked as an electrician, went through the apprenticeship for 5 years back in the early 90s, and then work was starting to slow down in 2000, late 2000, 2001. Mm-hmm. And then eventually, got laid off from an electrical contractor down in Springfield in June. Nobody in the construction field gets laid off for the summertime.
Yeah.
But I did.
But you did, yeah.
But I did.
Yeah.
Just luck of the draw.
Yeah.
Huh?
And there was no work in sight. My foreman handed me my check right before noontime, right before lunch, and said, "You better get back to the hall and sign the books because there's a lot of people laying off today." And when I got to the hall, I signed the books at like number 100, 101, somewhere in there. So they already had mass layoffs. And I call it Bundy luck.
Yeah, yeah.
Then September the 11th hit.
Oh.
And when September the 11th hit, it seemed like the country just shut down and nothing occurred. Nobody wanted to build anything. Nobody wanted to spend any money. Nobody wanted to improve anything. And so I spent virtually 13 months unemployed. And
Oofta.
by happenstance, I needed a job. I wanted a job, and I didn't care what kind of job it was. So I went to Sheriff Tony Solomon, said,
"Oh yeah,
can you put me to work in the jail? Can you just put me to work? I need a job."
Yeah.
And there was no work in sight, and I'll never forget it. I was at the courthouse talking to him. He said, "Well, wouldn't deputy suit you better?"
Oh.
You know,
I
a
reckon.
little light bulb turned on above the head, and I said,
"Yeah,
well, why not?" He said, "Well, we're going to test in the spring."
Well, listen, Chief, you mentioned unemployed. If Judy and I don't bring around the commercials, we're going to be unemployed.
Yeah, there you go.
Every Wednesday morning, we're always late with our commercials. Go right ahead, Mr. Rash. And we're back live in the studios here. The program, of course, is Viewpoint. We appear each Wednesday morning, or try to appear at least 8:15 to 0900 hours. Our guest this morning, I want you to pay particular attention to our guest. You might have a question or two. 648-5510. Our guest this morning is Chief Matt Volkovic, a gentleman whom I respect greatly. He inherited that from his family, so that goes back a long ways. Chief, one would like to think that in a small community like Lincoln, hazard is not necessarily present, but that's not a true statement, is it?
That's not true.
You can't anticipate stopping a car for a normal routine traffic regulation. You can't go up to that car and feel comfortable, and that's a terrible thing.
Yes, it is.
And that's a daily thing every day with your men on the street.
That's correct.
Particularly in view of the fact that we're halfway between Chicago and St. Louis, and there's a lot of stuff going up and down that highway now.
It's the unknown. Every time you stop a car, it's the unknown. And no disrespect, you use the word routine. We can't use that word anymore with routine police work or routine stop.
There's no such thing.
Routine call for service or anything like
yeah.
that. What I like to use is the high frequency, low risk type of calls. And then you have what we call the low frequency, high risk type of calls. Mm-hmm. We don't have a lot of low frequency, high risk calls in Lincoln, but they absolutely do. They do occur. And you got to be buttoned up to take care of it because it's not routine.
You mentioned just a little bit ago that the source of the problem is the home.
Absolutely. And nobody's going to waver my belief in that. I don't care. You can talk to me till you're blue in the face. Look at where we're headed as a country. Just overall society.
Yeah.
The values, what I grew up with, what you grew up with, what we all grew up with, it all starts at home. And if it's not being taught at home, where's it going to get taught?
But we have these throwaway kids. So who's to teach them?
Well, you would hope that the schools would get a hold of them.
Well,
but they're limited.
You have to use that hope in quotes.
Yeah.
Yeah. So unfortunately, the
hope in one hand, spit in the other, and see which one fills up quicker.
Correct.
Is your I know that you have the total support of our city government. What about our budget situation? Whence cometh the money? They have to. The city council is responsible for making the budget. Is that correct?
That's correct.
And so we can hope that they'll find every day the money's necessary, because it's not inexpensive to open the door every day for business.
Absolutely not.
Will all of your officers, are they equipped with cameras now?
Dash cameras.
Yes.
We've talked about previous radio shows, the Safety Act that the Illinois legislature passed. One of those unfunded mandates was body cameras. So they're doing it in phases. Our municipality of our size isn't required to have an operational body cameras until the year 2025. However, Chief Adams, in working with the mayor and city council, the mayor is an advocate for these body cameras. They're very expensive.
Well, I'm sure they are.
So we are considering either phasing them in because they're so expensive over a period of time, and or purchasing them early, because they not only help the public, but they help the officer against frivolous allegations. They're a very, very useful tool. So why not take advantage? If the technology is there, why not take advantage of it? But then it becomes the daunting task of finding the money in what seems to be a pretty finite budget. So we have to find a way to become more efficient, to save money, to get things like this purchased.
So if some individual out there decides at Christmas time, I'd like to do something nice for my community, if he wanted to buy a radio or two, he would be very happy to accept that, wouldn't we?
That absolutely, and that's something that we're considering as well. If we're having a hard time getting those things bought, maybe asking and developing a public-private partnership between the community and the police to get things like that purchased. It's in need. It's in dire need.
And by the way, that won't give you any immunity for parking in the wrong spot, folks. But seriously, Chief Matt Volkovic has been with us this morning. We appreciate very much your taking your time, Chief. We know that when you report for duty, you never know what's going to be on your desk. Every day is a different day.
Every day is a different day.
Putting out fires every day.
Yes.
Even though he's a police, not the fire department. Thank you very much, Matt, for being with us this morning.
Thank you for having me.
We appreciate it.
It's a pleasure.
I want you folks to, we veterans get thanked all the time. It's not out of the order to thank a policeman if you see him on the street. You don't have to be obnoxious about it. Just say thank you for your service, just like they do to we.
And I before I leave, I want to thank all of the fine women and men that work for the Lincoln Police Department for the job that they do every day.
Thank you very much.
Can't thank them enough.
Chief Matt Volkovic, thank you very much, sir.
You're welcome.
Right back in the live studio here. This program, of course, is Viewpoint. We have a bifurcated program this morning due to those known as short-term memory problems. And I'm going to tell a quick story.
That describes us real well, Bill.
I'm going to tell a quick story about short-term memory. Gene suffers a little bit of that right now, which is not surprising at our ages. So the other day I put my hearing aids in, and I had my right hearing aid in, and I couldn't find my left one at all. Got down on my hands and knees with the flashlight on my computer desk. Couldn't find that, and got a little panicky because this is a pretty good thing for me to. Anyway, I finally found out I already put it in my left ear. So I went out to tell Gene. I said, "Well, let's don't worry about short-term memory. I suffer more than you do." All right, just introduce our guest this morning, please.
Yes, Don Cavi is the head of the health department of the county of Logan and the state of Illinois. And we're in a Melda Hess in our world right now with this COVID. And of course, that's going to be our subject today. just inevitable.
Okay,
because
Dr.
it's
Fauci.
everywhere.
Yeah.
Yeah. Oh gosh, no, don't be Dr.
We
Fauci.
have a Logan County Dr. Fauci with us. He's going to pontificate on this COVID thing. Seriously, we just mentioned off air that you mentioned that COVID is up here a little bit in the county, sir.
Starting to see a rise again, and so we're
Why? Because we get complacent?
well. That could be part of it. Absolutely. I think people are tired of having to wear the masks,
Yeah.
and I get it. I get it. But we are starting to see an upswing. It seems to go through peaks and troughs. People, the numbers go down, people get a little more relaxed, and the numbers go back up again. Now we're seeing the Omicron variant, and we've had the Delta variant, and so we're as a health department, all we're doing is trying to get people educated and vaccinated. The CDC certainly is pushing for the vaccine, and we're trying like crazy to get as many people in the communities vaccinated.
How are you doing here in the county of Logan?
In terms of vaccination numbers, right now about 51% of people in Logan County are
Shouldn't
fully
we be
vaccinated
more than that,
right now.
Mr. Cavi?
You know what? Yeah, I mean, statewide it's higher.
Yeah.
But if you look at Logan County compared to other counties, where there's 97 counties in Illinois, we actually rank. We're in around the 50% area, about 40 out of 97 counties. In terms
But
of
you
being
folks at the
vaccinated.
Logan County
So
Health Department out there on 3rd Street make it so easy to get vaccinated.
we do.
I mean,
we
you
do.
have a system that's just flawless.
Yeah, I think I think just in general there are some people that just don't want to get the vaccine, and we try our best to get as many people in the door as we can, but for some reason it's just inevitable it happens. And some counties, and you're finding a lot of the counties up near Chicago, they're having much higher immunization rates than they are down here in central Illinois, for the most part. The larger counties tend to have higher immunization rates is what I'm seeing. But like I said, we're kind of in around the 40 out of 97 counties. So we're holding our own right now, but we certainly like to see more and more
What
people
do
get
people
vaccinated.
say as to why they don't want to be vaccinated? From the time you have your first child, they give you the schedule, and you start the vaccinations with just tiny babies. Mm-hmm. And it's just a way of life. And now you come to this particular vaccination, and people say, oh, no, not me. I'm not getting that. Well, what in the world kind of logic is that, please?
Everybody has their reasons for it, and I hear a lot of different things. We all do. Some people are concerned with possible side effects. And people that have been vaccinated, sure, they may have a headache for a day or may have some soreness. But people hear things and maybe they're afraid to get the vaccine. To me, if I'm going to be sore for a day or have a headache, I'll take that risk. It's better than being sick for 10 days or 10
gosh,
or
yes.
But that's just the way I look at it. So I think there's some concern about that. And then now that Pfizer's got the vaccines for the kids now, I know a lot of parents are maybe concerned about that, and then people think that even younger kids are less susceptible, which they do handle it better. Their symptoms may not be as severe, and maybe parents think that
But they
we don't
say
need to get them.
people aren't taking advantage of it for their children. Is that right?
The numbers are down. Yeah, I mean, right now, and I can look at our currently where we're at, and we just started providing that vaccine because it wasn't too long ago that Pfizer was approved for it. But for ages 5 to 11, we're only about 3.5% of people that are vaccinated. But really, again, we're in the middle of the pack of the state, so it's certainly not just the Logan County issue. But I think, again, parents, maybe there's some hesitation there because, maybe they have some concerns about side effects. The dose is a lower dose. I mean, obviously, because they're kids. But I think, there might be some concern about that. And again, because they're kids, my child, they're healthier. probably don't need the vaccine. I think, maybe there's some hesitation there. Again, I can only speculate. I think parents have their own reasons for that. But I can say certainly the CDC is really pushing for the vaccine. I read somewhere the other day where adolescents who are unvaccinated are 10 more times likely to end up in the hospital if they get COVID, even though that number is probably pretty low, but they're still 10 more times likely. And I read that in an article somewhere. Can't quote me on where I read it, but I do know, and all I can say is I know the CDC is really promoting that, people at every age that's eligible to get vaccinated, get their vaccine. Even people who have had COVID, I've heard too from, medical providers and various people saying that, even if people have had the virus, they do develop some immunity, but even getting that vaccine will additionally provide more protection and keep people out of the hospital. So,
how about the mask? How effective do you think the masks are?
The only observation I can make from that, and I do think they help. As long as the mask's worn properly, I see a lot of people wearing it, under their nose, which that's not a proper way with a mask. It has to be up over the face.
I guess they think no air comes out of their nose.
I guess so. Maybe they just breathe in and out of their mouth. I don't know. But the mask, it does provide some protection, absolutely. So you can't argue that. And we encourage people to wear masks. I can, and you look at last year, our flu numbers were way down, and people were wearing masks. So that might be an indicator that perhaps masks are working. But the CDC says it is, and certainly it does provide protection. Absolutely.
Well, on the bad side, if you do pick up the COVID germ, and there you are, what are the long-term effects of this?
Of COVID, I know there's a lot of studies going on right now. It's, most people have the symptoms for at least, a week or 10 days or maybe 2 weeks. But beyond that, people I've talked to that have had COVID seem fine. Some people may have longer lasting symptoms. It all varies from people to people. Some people have been, permanently affected by it. So, the only thing I can encourage is that people, take precautions, wear the masks, prevent themselves from spreading it, get their vaccines. Now too, people are indoors a lot. Now with the weather getting colder, today's an exception to that. It's pretty nice out temperature-wise, but with more and more people indoors, it's very important that we protect ourselves, wash our hands frequently, wear our masks, especially out in public.
We always come back to the hand washing, don't we?
Oh, that's a big thing.
It must be the answer to most things.
That is
648-5510. Our guest this morning, Mr. Don Cavi. I'd like to, maybe a couple of our listeners out there, all of them, don't know the significance of the Logan County Health Department out there on 3rd Street. Let's give us an overview of what you do for this community. It's a very, very important. And by the way, you've gathered on this ship, Captain, some very nice crew members. You have a very, very professional group in your operation out there. Some of them are going to miss Mary Anderson a lot.
Yes.
That's just a personal observation. But you have... when they walk into that door out there, you're going to be received politely, professionally, and you're going to be glad you made that entrance. So let's just talk about the Logan County Health Department a minute.
Yeah, Mary retired on the 30th of November.
She's earned that right.
Yeah, over 32 years with the health department, and we're gonna miss her experience and miss working with her, but she's deserved it, and she. We wish her well on her retirement. We want to wish Mary very well there. Yep.
She's a lovely person.
Yeah. But as far as the staff we have now, absolutely. Our staff are wonderful. We have a lot of different services we provide to the community. As you know, we've got our WIC. We go out and we have environmental health, and we do our inspections and regulate with the food establishments, the water, the sewage. We do have a Health Works program where we work with 12 other counties to provide case management to children in foster care. We have a full gamut of immunizations that we offer. And we offer just a lot of services that preparedness to our, Faye Allison's our preparedness coordinator, and she's doing a lot right now, getting these clinics set up for COVID. And speaking of COVID too, I do want to give a shout out to our staff. We've had a lot of people that have put a lot of hours in, extra hours, working evenings and weekends, working on the clinics and following up with people who are positives, providing them with education or contact tracing, and doing data inputting, and really my hats off to a lot of people on our staff. People that have other roles are having to take on new roles and be flexible and adjust to COVID, and they're all doing a wonderful job. So you're absolutely right. We have a terrific staff. Now that Mary has retired, we do have two wonderful nurses, Cindy Harrelson and Carrie Slager, and they're just doing a wonderful job in our clinic. So I'm confident they're going to take the ball and run with that. So we're.
You mentioned food inspections. That's pretty darn important. If a restaurant gets a bad germ in their potatoes or whatever, you could have just a meltahess.
Now, do you have routine or unscheduled inspections of restaurants around the community, sir?
We're required, based on every restaurant is determined to be at a certain risk level, and the state of Illinois, which we've adopted their code, they provide risk level. Like, for instance, a convenience store, they sell food, but they don't prepare the food. It's in refrigerators, but some of it's potentially hazardous. So certainly we have to license them or issue them a certificate to operate, and we do inspect them, but they'll get a less frequent annual inspection than, for instance, a large restaurant that has a full service menu that is preparing more complex meals, where the foods involve potentially hazardous foods that are being cooked and reheated and cooled and whatnot. But when we do go to our routine inspections, they are unannounced, because we don't want them to know we're coming, because we want to catch them in their normal elements, just so we can see how they operate on a day-to-day basis, because that's how they're going to operate, and we want to make sure we're there for that. But we do regulate, we do inspect, but I also say we're an educator too. If we have a food establishment that's having problems, we're going to work with them, and we hope they work with us, because it's serving safe food for the public is very important.
When you're dealing with people, it's always kind of, I think, like raising kids. You say, this is what we do, and this is the reason we do it this way. Mm-hmm. And then people can say, oh, yeah, that makes sense.
Yeah, and you hit the nail on the head too. When we see an issue, for instance, a restaurant, we'll tell them what the problem is, but we'll tell them why the problem is too. For instance, if a food is a potentially hazardous food is at the wrong temperature, certainly we tell them this is a violation, but we'll explain to them that when that food is at room temperature, and let's say it's chicken or beef or something that's potentially hazardous, over time bacteria will grow in that food product given the right environment, in this case being temperature. And, once they put that connection together, then maybe they'll understand, hey, that's why we need to keep this food in the refrigerator. We can't just let it sit out on the countertop. So that you bring up a good point there, absolutely.
The staff, sir, are you fully staffed, or are you needing employees and or nurses, more importantly?
Right now we're fully staffed. However, we have been getting some grant dollars through the state for COVID, and if we need to at any time pick up any contact tracers or any extra staff to help us out with the COVID overflow, fortunately we've had some flexibility where we can bring people in to help us out.
It seems that they're kind of forecasting a real bumper crop of COVID for the coming months. Are you feeling that?
We're very cautious about that. Yeah, I kind of all hands on deck. We're going to look at the trends. hopefully, you know, if the situation arises where we need to bring more people in to help us out, we certainly will. The last few days, we've seen a lot of cases, and our nursing department and some of our other administrative staff who've been working on this have been putting in extra hours, but we are keeping an eye on it, and we'll continue to monitor that. So,
You know, we're kind of at the season where we're going to be having a lot of gatherings of people at the church and at one another's homes. Is that kind of a bumper crop for you?
yeah, it is. It's always a concern, but you know, I don't want to. I don't want to be the one to say, you know, if you're with your family, everyone's got to wear masks now. Whatever they do in the house is, you know. But we're just asking people to just use some common sense, you know. And we're all for the holidays, Christmas, family gatherings, and certainly enjoy the holidays. But you know, just use some caution. For instance, if you've been around somebody who has had COVID and you're not symptomatic, you haven't been tested, you know, don't go to a Christmas party, because if you're carrying it, you don't want to be spreading it to other people. There's a lot of common sense that comes into play here. If you have a family member who has COVID and you've been around that family member, you don't want to be out in the public, you know.
Yeah,
so
but you used the word common sense, Don, and unfortunately that's kind of a short commodity. Some of us out here don't do much of that.
He looks
seriously.
to me.
Sir,
he didn't look at me, so that's a good thing.
He looked at his partner, Mrs. Busby. No, seriously, I want to address the elephant in the community, addiction. Do you have a problem with addictions at the Logan County Health Department, people walking in with addictions?
You know, that's unfortunately that's a problem everywhere. I don't work on the front line, but I can say I know our staff do see people who we can say, you know, have likely had issues with maybe drugs or alcohol, and we're trying to be. One thing we want to aim for is we have a strategic plan out now, and we're starting to implement that. But one of the goals is we want to become a trauma-informed agency, and I'm working with a couple people to see how we can do that. But that'll help enable us to further recognize people who have either mental health issues or who have drug issues. A lot of those interplay with each other too.
Sure.
People who have behavioral health issues may be addicted to drugs or alcohol, but we want to certainly be more aware of and sympathetic to people that come into our office that may have issues where we can refer them to the right services. But yeah, we see our share of people, and I think, you know, it's pretty common, and it's unfortunate. You know,
This is a hard season for a lot of people. They have memories that are really good that they miss, and they have memories that aren't so darn good. Mm-hmm. And it's kind of hard for that percentage of the population to get through it.
absolutely.
What if I had an addiction, thank God I don't, to alcohol or any other addiction, drugs? Where do you find help for people? You have your own people on staff there who are trained, but there's only so far they can go, and patient X needs to go to the next level. How do you find the next level for patient X?
Well, we're really, you know, even though we primarily work with preventing health issues or promoting good health. We don't provide medical treatment per se, but, you know, we do have SIU right there, which does have a medical facility.
So that's your next step, where you hand off.
Well, what we do is our nursing staff and our staff are pretty well in tune with what other resources are out there in the community, either counseling services or whatnot. I know SIU has a licensed clinical social worker working there on site at our agency. But we do recognize those people, and our nursing staff, if they suspect any issues, they certainly would know who to refer those people to.
The fact that, do you see more problems in the community with the drug situation now through the health department, or would those come under the purview of people going to their own doctors?
I think we just see it overall. I mean, it's, it's becoming more of a concern. And you're hearing more and more about it. I know that the community, needs assessment, and the local community themselves are part of this community needs assessment. We have to do it every 3 years. We do it with Abraham Lincoln, or Lincoln Hospital, I think that it's now called. But the community has identified substance abuse as a top priority. So it's really does, yeah. And that's one of the issues that the community health improvement plan that we're working on with the hospital is over the next several years we'll be trying to tackle drug abuse. But I do believe that, the community is aware of it, and so you really don't have to dig to find out that's the problem, because people are coming forward and saying that, including behavioral health issues, and those are two of the top primary issues that we need to tackle.
Is drug addiction a cause or a result?
All
of the above.
Not being a clinical professional, it's hard to answer that question. I'm not really the expert on that, but I do know that there is a correlation that you do find a lot of people who have behavioral health issues. Also, a lot of them tend to be, have drug and alcohol issues as well. Not to say everybody does, but you do see there is a correlation between the two.
You said you're not an expert in that, but I'm going to say one thing, Don Cavi. You're sure an expert in making sure your crew on your ship knows how to run the ship. Our guest this morning has been withdraws that comment. Our guest this morning has been Don Cavi, who manages the ship, the Good Ship Health Department, sailing on 3rd Street there. Do you have any closing comments you'd like to make, Don?
Yeah, just a few things. Again, we talked about COVID, please use common sense. Wear your mask out in public. Wash your hands. Use hand sanitizers when you have the opportunity. Avoid large crowds when you're with your family, or if you're possibly with somebody who's COVID positive and you may be carrying it. Use common sense and just don't go around the community spreading it, please. We are doing contact tracing right now, and we are calling people who have been in contact with people who are positives to try to tell them, look, you need to quarantine, and we're just asking for people to cooperate. Be courteous with our staff, too. We get some people who don't like getting phone calls from our nursing staff, but we're asking, please be courteous. They're trying to help you. They're trying to help the families, and we're just asking for full cooperation. A couple other things I'm going to throw out there, Bill, is get the flu shots. Obviously, we want to make sure people get their flu shots. They can come to the health department anytime. I do want to mention this morning, our clinic, our walk-in clinic, is closed till 1 o'clock today. We had to make a temporary adjustment. We are short on nurses today. We are operating a booster clinic right now, a Moderna booster clinic. But those people are all pre-registered. Our resources right now are kind of in that area, and I just don't have enough to spread around this morning due to COVID, believe it or not. But we have... Our clinic will be back open at 1 o'clock, so I want to apologize to the people that want to walk in this morning and get some of our usual clinic services. So I wanted to get that out there. So if anybody plans to come to the health department today, just needs clinic services, come after 1 o'clock, please. And I think those are the main things. Again, I just want to, shout out to our staff for the wonderful job they're doing right now. They're working hard. COVID hasn't been easy for a lot of people, and I was talking to the chief on the way out, and I know it hasn't been easy on the police forces as well.
Right.
But it hasn't been easy at all on our staff, as they're putting in a lot of hours. Some people at our health department are putting in long hours, and again, I can't tell my staff, all my staff, how much I really appreciate all the hard work they're doing. So, but those are some of the reminders I want to get out. If anybody wants to, we do have COVID clinics. We're going to be planning some coming up down the road, but I would ask people if they want to know when our next clinics are, our booster clinics, pediatric clinics, to check in with our website, which is www.lcdph.org. They can actually register to get into some of our booster clinics and online there, or pediatric clinics. I don't have any dates announced as of yet. There are days, Wednesdays and Fridays, we usually will offer walk-in clinics for COVID vaccine. Usually Wednesdays J&J, and then Friday's Moderna. But I would tell people first to call in ahead of time just to make sure we have the vaccine available.
Give your phone number if you would.
Yeah, the number to health department is 217-735-2317.
Right.
And lastly, I want to wish everyone a Merry Christmas and a Happy Holiday to everyone here at the station and all your listeners.
Thank you very much, Don Cavi. Thank you, Mr. Jim Ash, the General Manager and Announcer par excellence at WLCN. He's allowed us a little extra time this morning because we bifurcated our guest. If you excuse that expression, though, be careful how you use that on the air, bifurcated.
That makes you happy, yeah.
On behalf of all the folks who use your facilities at 3rd Street there, the Logan County Health Department, you do a whale of a job. We want to thank them through you. Thank you very much, Don Cavi.
Well, we thank everyone for supporting us, and I thank you for having me on the show.
Thank you, sir.